Hi, everyone. My name's Hillary Flint. I am the Director of Communications and Community Engagement here at Beaver County Marcellus Awareness Community, otherwise known as BCMAC. Today is our fourth and final quarterly office hours for our AirSense project. So not only will we be going over Q4, but we will also do a little bit of an annual summary as well. We're really happy that you joined us today, and we're always happy to have Environmental Health Project here. Their organization is dedicated to protecting public health from the impacts of shale gas infrastructure, and they have been an incredible partner on the AirSense project from day one. So, like I said, they will go over the key summary for our Q4 report and then also an annual summary. So if you'll join me in welcoming Santosh and Nathan. Santosh is EHP's new Appalachia project coordinator, and this is his second webinar with us, which is exciting. And he moved here after working in Alaska. So welcome again, Santosh. And Nathan is the program manager for EHP, and his work is centered on analysis of air quality monitoring and the development of air pollution dispersion models and the evaluation of protective policy changes. So basically, Nathan helps us put this report together and figure out all the back end that, as community advocates, we do not have that expertise yet, but we're learning from Nathan and the rest of EHP, which is great. So I'm going to turn it over to them to talk about the latest report. And thank you everyone for being here today. As a reminder, if you have any questions, you can put them in the chat, raise your hand, and please stay muted if you are not speaking. So take it away.
Thank you for that lovely introduction, Hillary. Um, yeah, we could just jump straight right into it. So you can go to the next slide, Nathan. Thank you. So our agenda for this evening, we'll be going over a little bit about EHP, AirSense, and Beaver County. And then, as Hillary mentioned, we'll be talking about both quarter four as well as year one. And then before jumping into a Q&A, we'll discuss some methods to protect your health. So a brief overview of EHP. As Hillary mentioned, we're a public health nonprofit organization that defends public health in the face of shale gas development. We work predominantly in the Appalachia region, but we also have projects in the Northeast, as well as other regions of the country. We support communities through environmental monitoring, data and research interpretation, health impact assessment support, as well as public health guidance. And one of our projects has been AirSense, whose goal has been to give Beaver County community members access to real-time air quality information and resources to take action to mitigate health risks. So our monitoring period is September to November of this year for quarter four, and then we'll talk about the past 12 months as well. And we're detecting particulate matter, nitrogen oxide, ozone, and volatile organic compounds all through stationary monitoring. You can see a picture of one of the monitors there on the right. And then briefly about Beaver County as a community. So Beaver County has a population of approximately 168,000 residents, and a lot of the residents have um, existing chronic illnesses, so that makes them more susceptible to health risks that come from poor air quality than people who may be in other communities. So that's just some context as we go over the results and as we talk about the potential health risks faced to residents um, of the pollutants that are in the air. And then if you see in the right-hand side of this slide, the map just shows Beaver County and all of our monitors in the blue diamonds, as well as the Pennsylvania Department of Environmental Protection monitors. And then the clouds over here are the facilities that we are looking at, and the large facilities that receive higher amount of scrutiny from the EPA as potential sources of air pollution in the region. So just to jump straight into our air monitoring results. So the exact dates that we're looking at for the fourth quarter are September 2nd to November 17th. When we look at the 24-hour average monitor readings for particulate matter, just to briefly go over what particulate matter is before we do that, actually, PM 2.5 is a mix of solid particles and liquids found in the air. Some examples include dust, soot, and smoke, and it comes from complex reactions between chemicals released by industrial sites. So in this graph, we look at the 24-hour average reading because that's the same measure that the EPA uses to develop their standards for air quality. And in the legend below, you could see the colors of the AQI categories that the EPA designates for air quality. Green is good and yellow is moderate. And on the graph, you can see we only have green and yellow on the represented in the graph. So all of our readings mostly stayed in the good category, with a few spikes into the moderate category. And in general, our monitors stayed together, which means that it's coming from regional sources of pollution, but in one case, particularly around November 2nd, we see a spike in the blue line, which was the Rochester monitor, indicating a possible local source of pollution at that time. To give a little more detailed overview in table form, here you could see two columns to the right, on the left-hand column, all of our monitors, and the two columns on the right, we have the 98th percentile of the 24-hour readings. This essentially is based on the highest daily pollution levels, excluding the worst 2% of days, so that those extreme events do not affect what we're looking at. And on the green row, the second to last row, we have the EPA standard. So we have 35 as a standard for 24-hour readings, and then 9 for the average of all readings. And we could see that we have met that standard. All of the monitors had met that standard. Some possible explanations for this is that in the fall, we do not expect as much PM 2.5 formation compared to the summer. If you recall from last office hours during the summer period, we saw a few of these numbers go higher than the standard, potentially due to Canadian wildfire smoke or other pollution events, which was not the case for the fall. That being said, we should also look at 15-minute averages to see if there were possible spikes that are not represented by just looking at the daily numbers. And here you could see our 15-minute average monitor reading graph with that EPA 24-hour standard as the dotted line. And you see we do have a couple spikes that go above that standard. And so the reason we highlight this is because we met the standard for daily readings doesn't mean there couldn't have been potential health impacts at those instances. And common health symptoms from PM pollution include reduced lung function and cardiovascular disease, as well as short-term effects such as sinus irritation. Moving on to nitrogen oxide. So NO2 is emitted by a vast array of industrial facilities as well as car exhaust. It's important because it forms other pollutants in the atmosphere, such as ozone, which we know is very hazardous to health. Here we're looking at 1 hour averages because that's the measure that the EPA uses for their air quality standards for NO2. And similarly, in the previous graph, we see that we have stayed mostly in the good category. The majority of the graph is green, apart from a few spikes into the moderate category, which occurred on November 6th and 7th in Beaver Borough. Mostly, the monitors have been traveling together, indicating that we have regional sources of pollution, but those specific dates on November 6th and 7th show evidence that there might have been local sources of pollution in Beaver Borough. And moving on to the same table that we saw last time, except now for NO2. On the green row in the bottom, you see the EPA standard for the 90th percentile of 1 hour readings, as well as the average of all readings. So all of our readings here have met both EPA standards. And when we look at the 15-minute average monitor readings, we do see that there were some brief but high spikes in emissions that could be more easily observed here than the 24-hour graph that you were looking at. Most of them still remained below the EPA standard, but these short these brief high spikes is worth noting because exposure to NO2 can cause irritation to eyes, nose, throats, and lungs, and high exposures over short periods of time can aggravate certain diseases, particularly respiratory ones, such as asthma, causing coughing, wheezing, and other symptoms. So just we want to highlight that to show that there were some brief but high spikes in NO2. All right, moving on to ozone. So ozone can be found both in the Earth's atmosphere as well as on the ground level. At the Earth's atmosphere, it is considered good ozone. It protects our planet, but on the ground level, it's a contributor to air pollution and one of the main components of smog. Um, Unlike the other pollutants that we're looking at, ozone is not emitted directly from a facility. It's formed secondarily in the air through chemical reactions from other emissions such as NO2 or VOCs. And so looking at our graph right here, we could see that we have now entered the unhealthy for sensitive groups at um, during certain dates, specifically in early September, where all five monitors spiked um, above the or spike to that category. Um, so this is really important to note because this is um, not good. And ozone is very hazardous to health and can cause a lot of variety of health impacts. So um, we'll go over this or we'll delve deeper into this into the next table. Here you could see the EPA standards below for all the highest daily maximum 8-hour average readings. The EPA standard is 70, and all of our readings are above that standard for all five monitors. This is actually similar to last period's readings, despite us not being in the summer anymore. So during the summer, we typically expect to see higher elevated levels of ozone. Now we're in the fall, although this fall in September we did have many clear and sunny days, which could have contributed to the numbers staying elevated. And then in October and November, when we had fewer sunny days, we still saw the effects of the numbers being high. So just a little explanation of why we may be seeing these results in the fall when we may not entirely expect to. And we're not going to take a look at the 15-minute averages for ozone because since it's formed in the air and not emitted from a facility, as I mentioned, the graphs tend to be quite similar. All right, and finally for VOCs. So VOCs are volatile organic compounds that are human-made chemicals, and they're used and produced in things like the manufacture of paints, pharmaceuticals, refrigerants. VOCs from industrial sources and influence local air quality, and our monitors report single value for all VOCs. Called the total VOC concentration. So that's why we have PVOCs listed here. Currently, there's no EPA standard for VOCs, which explains why there's no colors on this graph like you saw previously when you saw the green and the yellow. And because of that, it's hard to say exactly which level of VOCs in the air is high enough for us to be concerned. Um, that being said, we even if VOC levels are low, we still want to investigate it further. And we'll take a look a little bit at that in the next slides. But briefly, right over here, um, we see that some of the monitors are reporting zero. So that's something that we're still trying to determine is if it's a reality of the situation or if it's a reflection of maintenance or something with the monitor. And we also see that they don't all move together, unlike a lot of the other pollutants that we looked at. In particular, there's a notable difference between the Beaver and Rochester monitors. So that indicates a source closer to those locations than the others. All right, so to look at the table, again, we don't have an EPA standard to compare it to, but um, we are comparing these averages to each other. Um, Overall, this is showing us that the VOC readings remained low. We have one instance in Beaverboro, or one case of Beaverboro where it was above our air qual readings and all of our AirView readings. And it is noticeable, but we would still qualify this or classify this reading as relatively low, because some other standards that other organizations have put out would typically set the standard at 50 or 100. So um, all of these numbers are obviously well below that. And looking at the 15-minute average monitor readings, we um, can see nonetheless that we do have spikes in VOC readings. So this is something that we want to inspect more. Again, it's difficult for VOCs to say whether or not a single spike is indicative that there are significant health risks for residents. But we do just want to highlight these spikes to say that it is something that we want to we want to investigate more in the future. One thing that we did notice with VOCs that was different from the previous monitoring periods is the VOCs and PM readings aligning. So you can go to the next slide, Nathan. So over here, we have singled out one um, specific location, Rochester Township. And you could see, except for the very beginning, a lot of the readings mostly aligned with each other, particularly around November 2nd, when we see more of a clear spike. But we also see some spikes around November 14th to 15th and October 20th to 21st. This could potentially be explained by the fact that sources and activities associated with PM 2.5 and VOC emissions. Um, there's certain events that would cause a spike in both, such as flaring. And during those cases, PM 2.5 can serve as a carrier for VOCs. So it could potentially increase the absorption of these chemicals into the body when inhaled, compounding the health effects on an individual. So these simultaneous spikes in PM and VOCs are something that we are um, going to look at further, and it's something that we didn't see in the previous monitoring period. So it's definitely in notable when we're looking at this quarter, and um, indicative that there could have been more health risks posed to individuals because of these simultaneous spikes. And this occurred during most of the locations, but when you put them all together in one graph, it's a little bit hard to read. So we just singled out the Rochester Township to show you for now. All right, so just to summarize, the data points to mostly regional with a few local sources of pollution for PM 2.5 and NO2, regional sources of ozone, and more localized sources of VOCs. For PM 2.5, none of the monitors exceeded the standard for daily as well as um, for daily standards and annual standards. However, we did see some spikes in the 15-minute readings, which could have caused health effects in individuals. NO2, similar. All of the readings had met the standard, but there were some brief but high spikes could have been of concern. For ozone, we saw that they all exceeded the standard. You can go to the next slide, Nathan. So for ozone, we saw that they all exceeded the EPA standard of 70 ppb, and we attributed that partly or possibly because of the higher level of clear sunny days that we had in September. Um, and although it dipped in October and November, the averages still stayed above the EPA standard. And finally, for VOCs, the total VOCs were generally low across the monitoring period, but as I just mentioned, the simultaneous spikes in PM 2.5 and VOCs are of concern because of its possible compounded health effects. Now I'll pass it to Nathan to go over our annual results for the past 12 months.
Fantastic. Thanks so much, Santosh. So yeah, I'm going to chat briefly about the data that we've collected over the course of, well, 11 months here. Um, before opening it up to any questions that you all have. So this has been a project that we've been really excited to be able to work on for this long, and when you're able to collect information over such a long period of time, you're able to get a good sense of how emissions and air quality are changing based on seasonal patterns, right? A lot of what Santosh just went over, pollutants in particular, like ozone and particulate matter, really have a lot of variation depending on the season that you're in. So being able to, at this point, take a look back over an entire year or thereabouts of data is particularly helpful to get a sense of overall air quality in the Beaver area. So I'm going to give a high-level summary here, but certainly if anyone has additional questions about this, I'm happy to dive deeper into it. Over the course of the year, we've really seen regional sources of fine particulate matter, that PM2.5, and nitrogen dioxide, that NO2, with more localized sources of VOC, and ozone formation being regional, which is just about always the case. This is in line with what we saw this past quarter. With fine particulate matter, PM2.5, on 59 of the 352 days that we're looking at here, so 17% of days, we saw that on a 15-minute average basis, every monitor in the group of these 5 remained in the good AQI category for the entire day. So that basically is saying all of the monitors were reporting good air quality on the PM2.5 front about 17% of the time. We would love to see this number higher, but it's a start, certainly. And the more monitors you tend to add to a network, this number can dip down just because there can be, some strange events that happen at a single location that don't happen at others. But what we're seeing here is about 17% of days across the whole monitoring network where we have essentially very little concern about the PM2.5 levels. We were able to identify both local and regional sources of fine particulate matter. We note that we're seeing mostly regional sources, and that is the case, but there were certainly instances where we were able to identify the impacts of localized sources. We aren't necessarily able to pinpoint those sources, but we were able to identify that there was something localized near the monitoring locations themselves, and not something that came in from outside Beaver County, for instance. And we also saw that our highest readings of fine particulate matter were in the summer months due to increased secondary formation of particulate matter and those Canadian wildfires. The other time we tend to see elevated PM2.5 in our work is in the winter, actually. Winter and summer tend to be the worst, and that is because of increased heating needed in the winter. We didn't see as much of that on these monitors that we tend to in similar projects, though. Nitrogen dioxide readings remained below the EPA standards across the entire year. And I should note the same was true for particulate matter, PM2.5, if we're looking across the entire year. And nitrogen dioxide localized sources were identified in the Monaca, Center Township, and Aliquippa areas. And as a reminder, as Santosh pointed out, NO2 comes from a whole large host of different sources, right? So this can be from industrial sources, this can be from car exhaust, this can be from wood burning. Basically, any sort of combustion really can lead to NO2 emissions. Ozone. So ozone is where we saw the worst readings. We saw that ozone levels exceeded the EPA standard of 70 parts per billion for all of the locations that were monitored. This is not a good thing, and also not necessarily surprising. The Beaver County area and other parts of Western Pennsylvania are not within attainment for the National Ambient Air Quality Standards for ozone, and the data that was collected as part of this project backs that up. So based on this information, the area seems to still not be in attainment of those standards. we saw that our increased ozone readings were consistent with the seasonal changes in ozone formation. So we saw more ozone when it was sunny out in the summer and decreases as it gets cloudier and cooler. VOCs are quite a bit different. We saw VOC levels that were generally low across the monitoring network with several high short-term spikes, similar to what Santosh went over for this past quarter. And as Santosh pointed out, it can be really hard when we're taking total VOCs to be able to say much about health risk. We don't know which individual VOCs are in this total VOC number. It could be something particularly dangerous, like benzene or toluene, or it could be something that's comparatively much less dangerous, like acetone. So since we don't know exactly what the sensor is detecting, it's really hard to say how problematic these readings are. However, we can say that the highest levels of VOCs recorded on this network were recorded in the fall, so in this past quarter, and we were able to identify localized sources in Monaca, Center Township, Pine Run, and Conway. So that is the overall summary for the entire year. I wanted to, before we go into the Q&A section, I wanted to just remind you all of resources to protect your health. These can be shared out and have been shared out if you have attended any of the previous office hours, but these are all good links for you to have access to. We have tools to check air quality. We have ways to clean your indoor air, right? Most of us spend our time indoors more so than outside. So being able to clean your indoor air is a good way to reduce your exposure to harmful air pollutants. There is the Austin Air Health Mate that we recommend. Although it is pricey, there is a DIY low-cost fan filter that Raucus has a good tutorial on how to put together as well. There is additionally a good amount of information out there on water and water quality and issues related to both surface water and well water. You can see some of those on here as well. And I also want to always suggest to folks that if you're feeling like I might be exposed to something, there might be something going on that's impacting my health, please talk to your healthcare provider. And if that is something that is tricky, I know healthcare is expensive and it can just simply be difficult to get an appointment these days also. That making sure you keep a complete health diary is a great way to be able to, if and when you're able to speak with a healthcare provider, really have a good bevy of information to look to and try to understand what could be, causing some symptoms that may or may not be related to environmental exposures, like air pollutants. So keeping a health diary saying, okay, what particular symptoms am I having? When am I having them? And what's going on in the world, right? What were you doing? Where were you? Was there anything going on in your neighborhood or county? Noteworthy. So all of that can be really helpful for personal health. EHP has a few other resources as well. We have a reporting card for folks, which gives you some key contacts to report anything that looks problematic to DEP or local officials. We have resources on protecting your health. We have resources that give you tips on talking to a healthcare provider and more information about health effects due to inhalation of particular air pollutants. So we'll make sure you get access to these links, and all of this can be found on the Environmental Health Project website, which is environmentalhealthproject.org. If you have any questions, we will do a Q&A now, but you can always reach out to us at the phone number or email address on the screen.
Thank you both so much. I feel like after a year's worth of data, we're finally seeing the types of patterns that we possibly suspected we could find. So this is really enlightening. I want to now open it up to questions. So you can either raise your hand and verbally ask a question or put something in the chat and I will read it out loud for you. So at this time, does anyone have any questions for either Nathan or Santosh? Okay, I'll read a question from the chat from Brooke. What happens when EPA ozone levels are exceeded? Does it trigger further action by the EPA or the state?
Yeah, great question. Santosh, I can take this one. So when you are out of compliance with national ambient air quality standards, effectively what that means is that emitters that are in the area that is out of compliance have additional requirements that they need to meet. So basically, the idea is if you're in a place that's already polluted, every emitter in that area is going to be required to put better pollution control technologies on their operations. I said every, but that is perhaps overstating it. It is particularly focused on the largest emitters, this program, where they want to make sure you're applying the best available pollution control technology that's out there. If you're putting out pollution that is leading to a particular area being outside of compliance. And uh, the system has, over time, helped bring a lot more places into compliance with these standards and has shown a way to work, albeit over long periods of time, to get air quality to improve. So that is still what's going on here. The Title V, the largest of these facilities, do have additional requirements in terms of what they're able to emit and what kinds of controls they need to put on those. But that, doesn't necessarily get this problem solved immediately, right? So that's largely how this regulatory mechanism works.
Thank you, Nathan. We have a question from Emily. How do ozone levels compare to Pittsburgh or other regional levels?
That's a good question. I don't have the comparisons in front of me right now, but I can look that up quickly. Um, I know Allegheny County, for instance, is also out of compliance with the National Ambient Air Quality Standard for ozone. But I do not know sort of comparatively which between Beaver and Allegheny County, for instance, which is further from being in compliance at this point. But I can try to bring that up real quick.
While Nathan looks that up, does anyone have any other questions? I think it'll be very fascinating to see some of the comparable data between, yes, Beaver and Allegheny County. In the future, I would love to see how this type of data compares to, Texas and Louisiana and places that are experiencing similar petrochemical build out. I think now that we have a year's worth of data, we can start looking at things like that. Nathan, have you found that yet?
I have not.
Okay.
Might take me a second.
All right.
Don't
In the
make it
meantime, Santosh, maybe
easy.
you can answer another question from Brooke, which is, are there any things we can do to reduce our VOC exposure when going outside? For example, wearing masks, checking certain data sources in real time, etc.
Was I muted? Can you hear me? Okay.
Yes, we can
I
hear
can
you.
hear you now.
Yeah, I would definitely recommend checking the data sources that were linked in the slides that Nathan talked about beforehand. I don't have the exact ones on the top of my head, but um, Nathan, you could maybe, if you're able to jump in for this one as well, that would be helpful.
Yeah.
But in the meantime, I will get them, I will um, look it up as well.
Thank you, John.
I do know
All right.
wearing an N95 mask or higher would definitely help. Obviously, would not prevent 100% of exposures, but that can be a good starting point is to wear an N95 when you go outside. And I also think checking any type of real-time data before you go anywhere, even if it just helps you with decision making. So maybe if you're going to take your dog for a walk, you check the Eyes on Air web page beforehand. And maybe that will help you decide when you do that. I know people have looked at it for letting their kids play outside. It is meant to help you make those types of decisions. So I think that's a really good starting point. Having an N95 or higher mask for if you go outside and you then, things change when we're out in the world. So you might leave the house and the air quality is great. And as you're out, it could change. So I think being prepared in that sense is helpful. And if you really want to take it, a step further, you could have a whole go bag, in your car, in your home, and really try to prepare yourselves for these types of instances. I know after the East Palestine train derailment affected my home, it changed how I looked at situations like that. And I really did a lot of work to prepare not only, if I'm out and about and there's an emergency, but also what if I had to stay in and shelter in place? And what does that look like? So I highly recommend looking up protocols like that. I will drop one that I helped create in the chat. This one is centered towards those facing disabilities. So, it's kind of like an extra layer of protection, and I'll drop that in the chat in case it's helpful.
Thanks so much, Hillary. Yeah, in terms of looking at information sources for VOCs, one of the tricky things with VOCs is that they can there isn't as much monitoring out there for VOCs, particularly real-time, publicly accessible information for VOCs. So it can be a little tricky to say, okay, what are VOCs looking like out in the community right now? The Eyes on Air page is one place that you can go and look at specific VOC levels on these 5 monitors at any given time. Or no, that's not true, Hillary.
I was just gonna say, so in 2026, we do hope to add real-time VOC readings to the Eyes on Air webpage. It's not there currently, because it's a little bit more challenging to talk about total VOCs. So Nathan, I don't know if you want to talk a little bit about why that is, but we are hopeful in 2026 we'll be able to get that on the Eyes on Air webpage. That way you're totally covered.
Yeah, so the issue with VOCs, as we talked about earlier, is that with this total number, you're reading a mixture of a lot of different compounds. It's a grab bag, and how much of each different compound can be wildly different, right? You could need 2 parts per billion of one compound to have it be potentially troublesome for um, health, whereas another you might need 200 parts per billion, 100 times more of the compound for it to start impacting your health. So when we have this one number that's sort of lumping them all together, it can be really hard to say, okay, similar to how the other pollutants are presented on the Eyes on Air page, where it's like, okay, we're in good or moderate or unhealthy for sensitive groups. We don't have that same kind of scale here um, for VOCs, for total VOCs specifically. So you're able to see trends and get a sense of when there's just more general VOCs around, but it can be hard to say exactly when it's going to be a problem for anyone's health and might start to see some sort of reaction. So the short answer to is there anything that you can look at is it's a little difficult to really point you to anything specific that you can say, okay, VOCs are okay right now. You can think largely about when VOCs are going to be more readily in the air. So VOCs are a group of compounds that they're volatile. So the idea is that they can readily evaporate at roughly room temperature. And that is going to increase with temperature, right? So warmer days, we do expect on average we'll have a bit more ambient VOCs, but that doesn't necessarily prevent some sort of emissions event from an industrial facility, for instance, to sort of override that on average trend, right? So that doesn't mean a cold day is inherently safe from VOCs, right? So there are these trends that we can look at, but again, it is tricky to be able to say, hey, VOCs are not a problem in my neighborhood right now. There are folks that have purple air monitors with VOC sensors integrated into them that you can look at on the purple air map. Those are labeled as experimental pieces of data, and they should be taken with a grain of salt. They are not necessarily the most precise or accurate instruments, but can give you a sense of a trend over time of, is it higher than it was when I was out yesterday or lower? The N95s are a good way to go if you want to be particularly protective. You sort of do have to get up to those sort of respirator masks with little pink cartridges on them that are specifically for VOCs. That'll give you a great deal of protection, but that's largely more for folks that are working around lots of VOCs. So people that are working with paint and paint strippers, stuff like that. And that is another big way that you can work to reduce your exposure to VOCs is make sure that you're not engaging in activities that means you're inhaling lots of them, right? So if you are painting, if you are, stripping paint off of something, if you're doing, or if you live near like an auto body shop, for instance, those kinds of activities are often associated with VOC exposures. And there's a lot of home goods that do off-gas VOCs. So new carpet, for instance, is a big source of VOCs inside people's homes. That it would be great to be able to look for low VOC carpeting or alternative ways to cover your floors. But I hope that answers your question. I
Yeah, and
do
I'll
note
just
that
add
John,
on to that.
oh yeah,
I have a indoor air monitor, and I like to look at it every once in a while when I'm doing things to see how it's changing. And I can tell you, I no longer paint my nails. After seeing the TVOC spike when you're painting your nails, you probably will not do that in your household anymore. If someone's making bacon, another one that I've noticed is a spike, certain cleaning products. So it's been a really interesting tool to help change my behavior. I can't control industry and what's outside of my home sometimes, but we all can have a little bit of control around what's inside our home, which can feel grounding in moments where you just feel like, you can't help what you're being exposed to. So, highly recommend. Raucous has a program that you can go through. I dropped it in the chat. And as a part of that, there is indoor air monitors. And so you can kind of go through that same process that I have to figure out how you might want to change your behaviors. And I also want to add BCMac currently has it set up that if TVOCs spike to a certain point, our staff does get a text alert. And we are doing this to try to figure out, what is the best way to bring that to the community. So we've been doing that for probably over 6 months now. It's never gotten to the point where, we've had to alert the community, but we're working on a process of what that would look like. And we'll likely do some type of focus group as we work out solutions, which is what we did to create the Eyes on Air webpage. So there will probably be a second part to those focus groups to help us identify what's the best way to get that information out there. We would love for a text to be able to go to anyone, but unfortunately, you have to pay by license. So that is not going to happen currently, but maybe in the future, if someone wants to donate some money, we would love to bring a service like that to the community, but that is probably far off. But for now, we're working on a way to get it on the webpage.
Fantastic.
Thank you so much, Brooke. We appreciate that. Does anyone have any other questions? Or Nathan, did you figure out how we compare to Allegheny County?
Well, John, thankfully, John Graham from Clean Air Task Force put in the chat that the design values, so basically what the government has said that Allegheny County monitors are reporting is at 68 parts per billion, and Breton Township, which is the highest one in Beaver, is at 66, which actually does put them both in attainment. So I believe I may have gotten confused somewhere along the line there. I apologize for that if that is the case. But yeah, those are relatively close. 2 parts per billion isn't nothing, but is relatively close in the evaluation of these standards. So Allegheny County is a little bit worse than.
Sorry to everyone in Allegheny County. It's not often Beaver County gets to be better at something, so, we're gonna take it where we can. Does anyone else have any other questions before we move into some short BCMac updates? I have a question for EHP, and I'm just curious, after a year of this project, what do you think we could do better in the next year? What do you think will be more helpful for our community? I'm just curious, if you wanted to share your thoughts on how this has gone down and how, we think we could improve in the new year. You guys are the experts that we've hired to help us. And I think it would be helpful for the community to hear, what this has meant for you guys and how you think we can make it better for Beaver County in 2026.
I can jump in briefly here. Well, there were a couple results we saw from this quarter that we want to investigate further. For example, like seeing the simultaneous spikes in PVOCs and PM 2.5. So when we see like results like that, we because we just saw it from this quarter, we know that it can compound health effects, and we know kind of what happens when PM 2.5 serves as a carrier for VOCs. But because we only have a quarter of, or we're only seeing that in a quarter, it's not something that we investigated in the past. So um, yeah, that's just, I guess, one example of some things that we would um, want to like investigate further in the future and see if that could be something that um, affects our results and the advice that we give to the community members about protecting their health.
Yeah, it's always good to go a step deeper.
Yeah, and you know, I think it's a good question. Improving these projects is always an important thing to be on the lookout for. But I do want to say that I think this project is, as it stands, and now as the past year's worth of monitoring has been collected and looked at, this is some of the highest quality community collected data that I've had the opportunity to work so closely with. And I think it's really a testament to, the wherewithal of BCMAC to have been able to put together a project that, was able to collect and report out to the community such high quality information that, ozone is not something that we're generally able to collect information on because these monitors are expensive and require significant maintenance and takes a lot of expertise to be able to get an ozone monitor working well, let alone a monitor that looks at ozone and a bunch of other stuff, right? So I think it's important to always be looking for ways to improve this work, but I think the work that has been done has been incredibly high quality and does serve the people of Beaver County to be able to not only put out information real time that people can go to Eyes on Air and look at, but also is able to corroborate or maybe supplement and disagree with at times the regulatory monitor networks because it is of a high enough quality to be in conversation with those state operated monitors, right? So I think perhaps doing more of that comparison in the coming year is something that could be helpful to compare these monitors to the regulatory monitor network. Although the monitor manufacturers have been doing some of that this past year. That's, I think, what comes to mind. But I do want to commend all the folks at BCMAC for making such a high quality project happen in the first place.
Thank you, Nathan. We really appreciate that. And this project took a lot of preparation before we even knew what we were applying for. Dr. Lau, our board member and longtime volunteer, had been looking at, what is the best type of air monitoring equipment we could get. And we got to dream big and actually go out there and get it. So we are very grateful for that. And our next phase of the AirSense project is trying to connect the air in and outside of your home to this kind of work, and then also in your body. What is your body exposed to? So we have officially started doing some of that collection with the University of Pittsburgh. We are calling this our community health project under the AirSense umbrella. And Hillary O'Toole and I just completed our training that we need to be able to bring this to the community in a way that is ethical and responsible. And, this way we can actually have our name on these types of reports and we can be the ones helping make this work happen in the community. So we can't say too much about it yet because we have to go through something called an IRB approval. But as soon as we can share more with the community about what that looks like, we definitely will. But for now, I do want people to know that we have passive air monitoring happening in 10 different communities, indoor and outdoor passive air monitoring. And then in 2026, we have some really exciting stuff coming up. And if you want to be the first to hear about that, highly recommend that you join our email list. So I will drop that in the chat. And we have some really great resources on a new webpage that we launched called Eyes on Health, which also includes a great tool from EHP called Compounds of Concern, where you can go in and actually look at some of these different compounds that are being emitted in and around Beaver County. And I will drop those links in the chat. Another thing is it's holiday season, so I did want to let folks know that BC Mac will be on holiday break from December 20th to January 4th. But we don't want to leave you hanging because even though we won't be in office, unfortunately, pollution happens full time. So we've tried to really build out and explain how to make reports, who to report to, and we have that all on our report and incident webpage. So make sure you utilize that in the meantime. Usually people are making reports to the PADEP and they have an online form, so it could be super, super easy. And we will be doing some additional documentary screenings in late January, early February of the new year. So, really finding all the different ways we can bring information, resources, and data to the people in Beaver County. If you ever have any ideas on other things we could bring to the communities, please let us know. I promise Hillary O'Toole and I are always out there looking for grants and new ways to bring more resources to you. We were the recipients of an EPA grant recently, which is allowing us to bring some additional episodic testing and handheld monitors. We're about to launch a lending lab where we will be working with youth in environmental justice communities and getting some citizen science tools directly in their hands. So we have a lot of really great things planned for 2026, and we can't wait to see you again. Our next AirSense office hours will be Q1 of 2026. So, start getting excited for that. And maybe at that point, we'll be able to share some of the deeper dives into the research that Santosh mentioned. I think that that's, really exciting that now we can go that layer deeper and we see some trends and we can keep pushing and nudging and bothering Nathan to figure out new things for us. So excited about that. But I am going to stop our recording shortly. And if anyone has any questions they were uncomfortable asking while the recording was going on, we'll give you a minute to ask that. And then after that, we will conclude. So thank you everyone for being here today for our AirSense office hours for Q4 and our 2025 annual summary. We cannot wait to see what air quality brings in 2026, and I certainly hope that it's better. So thank you for being here today.